Donepezil Hcl is a medication used to treat confusion, dementia, related to Alzheimer's disease. It does not cure Alzheimer's disease, but it may improve memory, awareness, and the ability to function. This medication is an enzyme blocker that works by restoring the balance of natural substances, neurotransmitters, in the brain. It is typically taken once a day before bedtime, with or without food. It is important to take it at the same time each day. The dosage is based on your medical condition and response to treatment. Taking it at the same time each day will help you remember to take it. Before taking Donepezil, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth once daily, usually at bedtime. If you have trouble sleeping, ask your doctor about taking it in the morning instead. If you are prescribed the 23 mg strength tablets, swallow them whole and do not crush or split them. The dosage will be determined by your doctor based on your medical condition and will be gradually increased to reduce the risk of side effects. It's important to take this medication regularly at the same time each day to get the most benefit from it. Do not stop taking it unless instructed by your doctor, as it may take several weeks to see the full effects. If you have any concerns or your condition worsens, be sure to consult with your doctor. Some common side effects of Donepezil Hcl include nausea, vomiting, diarrhea, loss of appetite, dizziness, drowsiness, weakness, trouble sleeping, shakiness, tremor, or muscle cramps. These effects usually last 1 to 3 weeks and then lessen. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you have any serious side effects, including trouble urinating, severe stomach/abdominal pain, black stools, vomit that looks like coffee grounds, or seizures. Get medical help right away if you experience slow/fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Donepezil, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor, especially if you have breathing problems, seizures, stomach/intestinal disease, or trouble urinating. It's important to be cautious when taking this medication, as it may cause dizziness or drowsiness. Avoid alcohol or marijuana, as they can increase these effects. It's also important to avoid activities that require alertness until you can do them safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Donepezil may cause a condition that affects the heart rhythm. This can rarely cause serious symptoms that require medical attention right away. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm problems. It's important to discuss all the medications you are taking and any medical conditions with your doctor before using Donepezil. Low levels of potassium or magnesium in the blood may also increase your risk of heart rhythm problems. It's important to talk to your doctor about using Donepezil safely if you have conditions such as severe sweating, diarrhea, or vomiting. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially heart rhythm problems. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding while taking this medication. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to check the labels of all prescription and non-prescription medicines, as some products, like aspirin or ibuprofen, may interact with Donepezil Hcl and increase the risk of stomach/intestinal bleeding. If you are taking low-dose aspirin for specific medical reasons, consult your doctor for more details. If an overdose occurs and serious symptoms like passing out or difficulty breathing are present, it's crucial to call for emergency help right away. In the U.S., residents can contact their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe or persistent nausea/vomiting, excessive sweating, very slow heartbeat, slow or shallow breathing, and seizures. It is important to take the medication as prescribed and not to share it with others. Your doctor may also monitor your weight periodically to check for any potential side effects. If you forget to take a dose, just skip it and take the next dose at your usual time. Don't take extra to make up for the missed dose. It's important to store Donepezil Hcl at room temperature, away from light and moisture. Don't keep it in the bathroom, and make sure to keep it out of reach of children and pets. When it's expired or you no longer need it, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.